Hi, everyone. I'm Nicola. I'm a physical therapist. Thank you guys for inviting me to be here today, and I'm really excited to talk to everyone online about falls prevention. And I have nothing to disclose. As Daniela said, we're here in two different sessions. Today, our first session, we're going to be kind of going over an introduction to falls. We'll be talking about some of the risk factors for falls. We'll discuss what is balance and what do we mean when we talk about balance, and what is the role of physical activity and exercise when it comes to balance and falls prevention, and we will finish up with an exercise session. And in 2 weeks from now, we're going to have another session where we go into a bit more detail about other things related to falls prevention, such as bone health, gait speed. We'll be talking about visual and vestibular systems and how they pertain to balance. And then we will be talking about some more specific falls prevention strategies that you can implement. And again, we'll be having another exercise session. So today, what is a fall? So a fall is something that happens when our body's center of mass, or our body, is moved beyond the base of support. So when you fall. We all kind of know what falls are. And this could be due to something like a tripping hazard, like, for example, if we trip over a cat. Who's tripped over a cat? I know I have. It could also be due to something like muscle weakness, where maybe your thigh muscles are weak and your knee gives out on you. And in ideal circumstances, our reflexes would kick in fast enough to tell our muscles to react in time. But in the case of a fall, our balance systems don't work together to keep us upright, whether that's due to sensory issues or slow reflexes or perhaps muscle weakness. And the result is a fall, where we fall and hit something, usually the floor, and this can cause some bodily damage. And as you can imagine, there's many different degrees of the extent of damage and disability that can result from the fall. In the United States, 1 in 4 adults age 65 or older reports falling each year. But fewer than half of those people tell their doctor, which is quite serious. And falls are the leading cause of both fatal and non-fatal injuries among older adults. Falls can cause things like broken bones, like wrists, arms, ankles, hip fractures, especially if a fall is combined with osteoporosis. Falls can also cause head injuries, and this is particularly serious if you're on blood thinners. If you hit your head after a fall, you should be assessed by your doctor to ensure that you don't have a head injury. Many people who fall, even if they don't get injured, can also become afraid of falling. This is called post-fall syndrome. So what happens if you fall and you become afraid of falling is you start to move less to try and prevent a future fall. And then that leads to weakness. And the progressive weakness and loss of mobility can increase your risk of falling. It will decrease your functional mobility. And this can contribute to nursing home admissions as well as loss of independence. So falls have more implications in addition to just injuries. So very serious. So falls are dangerous and costly, as you can see here. There's millions of falls each year, many of which result in injury, many of which result in hospitalization, admission into the emergency room, hospital admissions, and can even result in death. So they're very serious. They're dangerous and costly. They're a marker of frailty, and they can contribute to acute and chronic health conditions as we get older. So I'm here today and in our next session to talk about some of the risk factors for falls, how to mitigate them, and how to get moving to reduce the risk of falls, to stay healthy and active, and keep doing what we love to do safely. So what are some of the risk factors for falls? So research has identified many conditions that contribute to falling, and these are called risk factors. Most falls are caused by a combination of risk factors, and the more risk factors a person has, the greater their chances of falling. Not all, but many risk factors can be changed or modified to help prevent falls. These include age. Unfortunately, we cannot modify that. That's just part of life. I wish we could. But increased age is associated with decreased reaction time, so that can increase your risk of falls. Certain medications can also be risk factors for falls. So There's certain types of medications like benzodiazepines, diuretics, sedatives that can increase the risk of falling, but also combinations of medications. So if you're taking 4 or more medications, regardless of what those medications are, that can be a risk factor for having a fall. So you should speak with your doctor about that. Living alone, so solitary lifestyle, that can be an increased risk factor for falls as well. And injuries and consequences of a fall are increased if someone falls, they live alone, and then they can't get up from the floor and no one is there to help them. Things that you can do for that, which we'll talk about in future sessions, is having certain lifelines, like the fall alert systems that you can have or apps on your phone. There's other risk factors, such as nutritional deficiencies, which can increase your falls risk. Being dehydrated can increase your falls risk as well, as it makes you dizzy and lightheaded. Certain medical problems, cognitive issues, all sorts of things like that can increase your risk for falls. There are certain foot issues that can increase your risk of falls, particularly foot pain and bunions, or sensory issues of the feet, such as in diabetes. That can be a risk factor for falls as well. The environment is a big risk factor for falls. So clutter, having things like loose rugs or lots of cords on the ground, cats, dogs, kids, there's plenty of tripping hazards that are moving around your feet. So understanding where your items are at all times is important. Spills on the floor, slippery surfaces. I fell down the stairs once when I was sock feet on a carpet, and I hit all of the stairs on the way down because my foot slid out from under me. So certain footwear can make a big difference in your stability on the ground. Uneven sidewalks. I live in New York City. There's uneven sidewalks all over the place. There's many tripping hazards in our life that we should just be aware of and mitigate when possible. And other risk factors for falls are a previous history of falls and the fear of falling. Those are other risk factors for having a fall. So when we talk about balance, I think of balance as the opposite of falls. Being able to maintain your balance is the ability to prevent falling. So balance is the ability to maintain your body over your feet. Or your base of support. So we have 3 main systems that feed information to our brain to help us maintain balance. We have our somatosensory or proprioceptive system, which is what tells our body, like our joints, where our joints are in space. And we have nerve endings throughout our joints, our ligaments, our muscles, tendons, and skin that tell our body where we are and whether we're moving. And these nerves send really fast signals, but they do get slower as we get older, and they can also be affected by injury, which can accumulate as we get older. We also have our visual and vestibular systems, which we'll talk a bit more in the next session. And our brain takes information from all of these systems, integrates it, and tells our muscles how to react to keep our bodies steady. And in order to maintain balance, both statically when we're staying still and dynamically while we're in motion, all of these systems need to be functioning well to be able to hold us up. So exercise is something that we can do to maintain these systems. So let's talk a bit about exercise. There has been a lot of research on physical activity as it pertains to balance and falls risk. Exercise has been shown to be a very important factor in reducing the risk of having a fall. And people who are active compared to people who are inactive have a much reduced falls risk. And we suspect that the reduced risk may be due to a combination of factors such as increasing strength and endurance, maintaining and improving mobility, improving reflex timing, improving alertness. And so far, there doesn't appear to be an age limit, which is amazing. We have the ability to respond to exercise training and building muscles, even into the extremes of old age and even if you're frail, which is amazing. So there's always room for exercise. And in general, studies have shown that there are many different kinds of physical activity that can improve balance, and combining different types of exercise may have the best results of all. Muscle strength and size do decline as we get older, and muscular weakness is a strong predictor of falls in older adults in most studies, so strength training, particularly for your lower legs, will be an important component of falls prevention strategies. There's many other different types of exercise, such as aerobics, specific balance training. I heard people talking about Tai Chi before I logged in. And I'm also going to add in here flexibility, even though it's maybe less studied for balance, but since much of our day is spent sitting, we tend to get tight in a sort of a chair-shaped position. So working on flexibility is something that we'll work on today as well.